So today we're going to dive into something pretty incredible. A brand new AI that's basically acting like a detective for medicine's toughest cold cases, diagnosing rare diseases. We're going to look inside a system called DeepRare and see how it's cracking cases that have stumped doctors for years. Okay, let's get right into it. To really get why this is such a huge deal, you've got to wrap your head around this number: 300 million. That's how many people around the world are affected by a rare disease. We're talking about over 7,000 different disorders. So yeah, this is not some small niche problem. It's massive. And for pretty much every single one of those people, just getting an answer is this long, painful, and honestly exhausting journey. It's so common that it actually has a name: the Diagnostic Odyssey. Think about it. It's a marathon of doctor's visits, wrong diagnoses, and just one dead end after another, all while your condition is going untreated. And how long are we talking about here? On average, this odyssey lasts for over 5 years. Imagine that. 5 years of not knowing what's wrong, not getting the right help, and just unbelievable stress for you and your family. This is exactly why we so urgently need a better way to get these answers. So that really brings us to the core question here. What if we could take that 5-year journey and just crush it down into a matter of minutes? That is the incredible promise of new AI systems, like the one we're talking about today.
But before we get to the solution, we've really got to understand why this is such a wicked problem to solve. It's not just hard for doctors, it's also incredibly difficult for most AI. Let's break down the 4 main reasons why. Okay, so first off, the symptoms themselves are a huge hurdle. They're super complex and they can touch on so many different areas of medicine. Then you've got a massive data problem, because each disease is so rare, there just aren't enough cases for a normal AI to learn from. And on top of that, the science itself is a moving target. We're discovering hundreds of new genetic diseases every single year. And finally, and this is a big one, you've got the trust issue. Doctors can't just take an AI's word for it. They need to see how it got to its conclusion. They need to be able to verify the work. And this is where our AI detective finally enters the scene. A team of researchers has built a new system called DeepRare, and it's designed specifically to take on those 4 challenges. And it's a totally new kind of AI called an agentic system. So think of it like this. A normal AI might just look at a spreadsheet, but an agentic system? It's more like a project manager. It actually puts together and directs a whole team of specialized AI agents. Each one has its own job, and they all work together to solve the case. And DeepRare is the very first system to use this kind of team-based approach for rare disease diagnosis. So how does this detective start its investigation? Well, it gathers clues from all over the place. It can read a doctor's regular, unstructured notes, it can process all the structured medical codes for specific symptoms, and amazingly, it can even analyze the raw data straight from a genetic test. It's this ability to bring all these different types of information together that makes it so powerful. So let's pop the hood and actually see how this team of AI agents works together. You can really picture it as a super coordinated detective agency, where every single agent has a very specific role to play in the investigation. Okay, I know. At first glance, this diagram looks really complex. And yeah, it's a sophisticated system. But don't worry, we're not going to get lost here. The key is to see it as 3 simple layers, kind of like an onion, working from the inside out. Let's start right at the core. At the very center of it all, you have the central host. This is the master detective. It's powered by a large language model, and its job is to manage the whole process, pull all the evidence together, and make the final diagnostic call. Working for that master detective is the next layer, the agent servers. Think of this as the team of specialists on the ground. You've got an agent that's an expert in analyzing symptoms, another one that's a pro at searching through medical literature, and a third that's a genius at decoding DNA data. They do all the detailed legwork and report back to the central host. And that outermost layer, that's the data sources. This is the AI's enormous library. It's plugged into over 40 different tools and constantly updated knowledge bases, pulling from the absolute latest medical research, clinical guidelines, and patient databases, so its information is always current. And all of this leads to what is arguably the system's most critical feature, the one that solves that black box problem we talked about. DeepRare provides something called traceable reasoning. It doesn't just give you an answer, it actually shows its work, leaving behind a clear, step-by-step logical trail that connects its conclusion all the way back to specific, verifiable medical evidence.
This is the game changer that allows a human doctor to actually trust what the AI is saying.
All right, so the theory sounds amazing, right? But the real question is, how does it actually perform when the rubber meets the road? Let's get to the testing phase and see how this system stacked up against the competition.
Now, the researchers did not mess around here. They put DeepRare up against 15 other methods. And this wasn't just easy competition. We're talking specialized diagnostic tools, other giant language models, and even different advanced agentic systems. It was a seriously tough test.
And the results are, well, they're kind of staggering. This chart shows how often each system got the right diagnosis as its #1 suggestion. DeepRare nailed it almost 58% of the time. Now look at the very next best method. It's way down at 33%. That's not just a little better, that's a massive leap forward. DeepRare is playing in a league of its own.
But what about that traceable reasoning? Can doctors actually trust its logic? Well, to test that, human clinical experts went through and manually reviewed 180 of DeepRare's diagnostic reports. And get this, they agreed with the AI's reasoning and the evidence it used 95.4% of the time. That confirms the system isn't just accurate, it's also genuinely trustworthy. So let's zoom out for a second. What does all of this really mean? Let's look at the big picture and what this kind of tech could mean for the future of how we practice medicine.
You know, the researchers themselves sum it up perfectly. They see DeepRare as a trustworthy decision support tool. The goal isn't to replace doctors, it's to give them a powerful new partner, a co-pilot that can help them navigate these incredibly complex cases and, hopefully, end that diagnostic odyssey for millions of patients.
And that really leaves us with this powerful idea to think about. We've just seen how a team of AI detectives can crack some of the most difficult cases in all of medicine. So the question we have to ask ourselves now is, if this approach can bring answers to problems that have stumped us for decades, what other huge, complex challenges are just waiting for their own team of AI agents to solve?